Hey, I'm Dr. Jenn, and you are in the den with Dr. Jenn. Today, we will be talking about fertility and how to boost yours if you're a woman struggling with infertility. Our sexual fun fact asks about the impact of caffeine on male fertility, and a recommendation of Infertility Journeys, the book. Stay tuned. Infertility. Now, many of us do everything we can to avoid getting pregnant. So it's quite a shock to then want to have a child and realize that you can't. So we have a guest here today to address just this. This is the fertility goddess herself, Donna McIntosh. And Donna offers nutritional wisdom for fertility and healthy, happy babies. Yay, welcome. Thank you so much.
Thank you, Dr. Jenn.
Okay, so where is this goddess of fertility? Where does this name come from, and why do people call you that?
Well, it's because I devoted my whole nutritional business built around couples who are trying to conceive. I went through many years of infertility. I struggled very much in my late 20s and early 30s, and went through 11 intrauterine inseminations and injections and drugs, and I never did conceive, and it was devastating. So I have devoted myself to helping other people not go through that devastation, because I know how desperate it is when they are trying to conceive.
Wow, yeah. Okay, so what do you do to help people conceive?
Well, I've built a program that I work people through, and it helps them build their reproductive system up. It makes it strong, because women need to have strong eggs, healthy eggs, a strong ovary, and men need to have an abundance of sperm to be able to have those little suckers swim on up there and get that egg. And so, and then the question begets, well, how do you do that? You don't wave a magic wand. It doesn't happen. And it's like anything else. What you eat does affect your health. And so what you eat does affect your health of your reproductive system too, as well as then your fertility. And there's an old Chinese proverb that says, when you properly prepare the soil, your harvest will be bountiful. And so any gardener knows that you want to really prepare the soil in order to have a healthy plant. And so I take that into people's fertility as well. And so women need to have their healthy seeds, which are their eggs. Men need to have their healthy seed, which is their sperm. And then the woman's uterus has to be healthy, because that's the soil that is going to be implanted into.
Yeah.
So lots of studies have been done for just even minor changes in nutrition that really do boost the chances of ovulation and a healthy pregnancy and carrying to full term. So it's really awesome.
It makes so much sense too, because you wouldn't expect, I mean, your analogy of soil is so perfect, because if you got crappy soil and you put seeds in it, you're not going to expect it to do much. It's not going to be able to grow and give the nutrition that it needs to flourish. So.
No, exactly.
Okay, so I know you address a lot of myths, and what recommendations do you give?
Gosh, there's so many of them, but I've chosen a few today to talk with you about. The first is that women believe that they don't have to take care of themselves until they get pregnant. And so then it's like this, oh my God, I got to stop drinking, I got to stop smoking, maybe I should pay attention to what I eat, and maybe I should take a vitamin. You know, they don't really even know what they're supposed to be doing. But our ancestors in traditional cultures used to take couples, both the male and the female, and they used to try to feed them special foods, which I've labeled the sacred foods of fertility. And they used to feed these couples for at least 6 months. They liked a year, but sometimes those foods weren't abundant enough, so they only had 6 months to work with. And these foods, once they were fed them for 6 months, the couples, when they got married, actually conceived very easily. The women had no trouble in their pregnancies, and they were able to have healthy, happy babies.
Huh. What about specifically intake of fat? Because generally we hear fat's bad type of thing. How is this connected?
Excellent question. Yeah, we have had it drummed in our heads for decades, since like the 70s with Dr. Pritikin, with the low-fat diet. And actually, we need these fats. We need saturated fats. People think saturated fats are bad, but our traditional cultures used to eat a lot of fat. In fact, almost 70% of their diet was from fat: buffalo fat, bear fat, any kind of fat that they could get. And we also need what I know most people have heard of them, the omega-3s and the omega-6s. And these actually help, every cell in the body needs them. And they're essential because you have to eat them. Your body cannot make them. And so the omega-3s and 6s help the female in the way that they help actually ovulate. They help the ovary rupture so that the egg can come out. Oh. And then after the egg is released, they also help the follicle collapse, because without that collapsing, you won't have progesterone made. And so we need progesterone to help build up the uterine lining for implantation.
Fascinating. Okay,
Yeah.
One final question.
Okay.
What about the other side of fat in terms of body fat? Because I know that can be connected to women's fertility overall. How is it connected here?
Absolutely. And this is something that a lot of women don't think about. The percentage of body fat is very important. You don't want it too high, and you don't want it too low either. And a lot of women are starving themselves, and even on low-fat diets, so their body fat is not up enough. And actually, like 12% of infertility cases are caused from body fat percentages, either too high or too low. Yeah. And there's a syndrome they call polycystic ovarian syndrome. Yep. And that is one of the leading causes of infertility in United States women. And it is directly affected to the diet and part of the your fertility. So it'll block it.
Mm-hmm. Wow, thank you so much.
You're so welcome.
Thank you. If you want to learn more about Donna's work, you can visit her online at thegoddessoffertility.com. Sexual fun fact, true or false? Caffeine negatively impacts a man's fertility. Is that true or false?
True. False.
Okay. And who said false? Oh, you're the only one? Okay. Oh, there you go. It's complicated. See, that's why everybody got it right. But I just gave one. Okay, I've actually read a whole bunch of different accounts. Some say that it has no impact. Some say that if a man has a normal sperm count, that it could actually reduce it. And some, in particular Donna, argue that this reduction is due to a strain on the adrenal glands, which makes sense. On the other hand, some researchers claim that for men with a low sperm count to start, that it could actually increase their fertility, presumably because it helps the little guys swim faster. The Den recommend. Lesley Vance has a book called Infertility Journeys. This is a book that she wrote about her own journey and discoveries experiencing infertility. Lesley is local to San Diego and offers support groups to women. Now, Donna has recommended this, and I'd like to know why. Why do you think this book would be valuable to those that are struggling with infertility?
Lesley had her own battle with infertility, and she had several reasons why she was infertile. And she really addresses all those really well for people. And she gives you an enormous amount of resources for people who are looking for doctors, etc. So she's fabulous.
Nice. And I think you mentioned before, too, something about it gives a lot of how to get past emotional blocks.
Yes, because she experienced it herself just as I did, and she is a writer, so she was really dynamic in putting it down into words so that people could read, absorb, and then understand what their own journey was and what they needed to do on their journey in infertility.
Awesome. Yeah. Thank you so much.
My pleasure.
So, in conclusion, I want everybody to thank Donna McIntosh here. That was incredibly valuable information for women around fertility. And I want to direct you to a few places online. One is undergroundfurniture.com in San Diego's Pacific Beach, who generously provided the Sexy Den furniture. And if you want to find me online, you can go to DrJennsDen.com or to DrJennsDen on Facebook or Twitter. And let me know if you'd like to work one-on-one with me in counseling or coaching, in person or via Skype. Now don't miss the funny or outrageous outtake after the credits. And as always, be kind to yourself.
So there's just a lot of myths that we're taught. Even soy we're taught is good for you, but it's not. It actually blocks your fertility, and it blocks the male's strongness, his virility. So even today I was at Trader Joe's and I saw a man, getting soy milk, and I just wanted to grab him and say, don't. And even they're finding out that
he drinks soy milk instead of using condoms.
That's another approach. I never thought of that. That's another approach.